San Francisco Department of Public Health's Chinese Language Media Roundtable on COVID-19 flu and RSV updates. 今日係2024年10月9號，我哋三藩市公共衛生局再次好高興同大家見面，亦都係今日再度做呢個華文傳媒嘅新冠病毒 RSV 同埋流行性感冒嘅最新嘅通知同大家分享嘅。Today we're honored to have two of our doctors from the San Francisco Department of Public Health, Dr. George Han and Dr. Albert Yu. Would you like to introduce yourselves and your title in English first?
I'm Dr. George Han, a Communicable Disease Director here at the San Francisco Department of Public Health.
呢位係我哋黃信醫生，黃色嘅黃，信念嘅信。咁黃信醫生咧係我哋衛生局嘅傳染病毒科嘅主任，傳染病毒科係。
Good morning, I'm Dr. Albert Yu. I'm the Chief Health Informatics Officer for the Health Department, as well as the Acting Director of Ambulatory Care. 我中文名係余英強。
咁呢位余英強醫生咧，英係英雄嘅英，強係強力嘅強。咁咧，余英強係我哋嘅 Chief Health Informatics Officer， 係我哋嘅總衛生數據資訊嘅總監。咁亦都係我哋嘅代理緊急護理科嘅主任嘅。So at this point, I would like to first turn it over to Dr. George Han to share your information first. Thank you.
Thank you. So this morning we're here to talk about COVID, flu, and RSV, particularly about COVID and flu. And so pretty much everyone should be getting a COVID and flu vaccine this fall. As you know, we've long had flu shots that have been every single fall, and the reason for that is because the flu virus changes every year. And so what we want to do is we update the flu vaccine every year in order to cover the latest strains of flu. Similarly, we're now in the same boat with COVID vaccine, and so most of us have gotten many COVID vaccines already. And so the message is really that just like the flu vaccine, we want to get the COVID vaccine every year. Every year there's a new updated COVID vaccine, and so this year's is no different. We have an updated COVID vaccine for this fall, and it is covering the most recent strains of the COVID virus. And it is still the best way to protect yourself and your loved ones from the serious effects of COVID, including hospitalization and death. And so it's really important for everyone ages 6 months and older to get both the COVID and the flu vaccines. And just to talk a little bit about the age, so that essentially includes children and adults, elders, and we especially want anyone over the age of 65 to receive both of these vaccines because our elders are the ones who are most vulnerable to getting severely ill from COVID and flu. In addition, we have an RSV vaccine, and so this is a vaccine that came out last year. RSV stands for respiratory syncytial virus. And that is a virus that can cause also pneumonia and sometimes severe illness and death, especially in those who are elderly. And so that's a new vaccine that just came out last year. Unlike COVID and flu vaccine, that is a vaccine that so far you only need to get once. And so if you got it last year, you're okay. But if you haven't gotten it, then go talk to your doctor to see if the vaccine is a good one for you to take. Another group that I want to talk about is pregnant people, because if you're pregnant, you actually should get all of these vaccines during your pregnancy, and let me explain. So when you're pregnant, it's really important to get the COVID vaccine. It's also really important to get the flu vaccine. And so for sure you want to be getting both of those this fall. And that's to protect yourself and preventing yourself from getting any complications from the pregnancy. It's really, really important for anyone who's pregnant to get COVID and flu vaccine. And it's also important to get the RSV vaccine if you're pregnant in between weeks 32 and 36 of your pregnancy. That is the time, this fall would be the time to get RSV vaccine if you're between those weeks 32 and 36. So for those who are pregnant, it's an important time to talk to your doctor, make sure you get these vaccines, and particularly these are vaccines that you need to get with every pregnancy. And so even if you've gotten it in prior pregnancies, you want to get it for this particular season with every pregnancy. So that's a really important message that a lot of people may not be aware of. And so I want to make sure that anyone who's pregnant knows that. And just to reemphasize that even if you've gotten COVID and flu vaccines last year or in the past, because they are both updated every year, you want to get it again this year, and that's for everyone who's aged 6 months or older. So that's babies, children, adults, and our elders. And one final thought that I have is that the federal government is providing free COVID tests again. They are available at covidtests.gov. You can just sign up, and the government will send you by mail 4 free COVID tests for your household. And so that's important because if you are able to test, if you have symptoms and you find out that you have COVID, then you can potentially get treatment like Paxlovid that can help lessen the symptoms of COVID, help prevent you from needing to go to the hospital or becoming severely ill. And the sooner you take that treatment, the better it is for you. You don't want to wait until you're really sick and then you start taking the medicine because it doesn't work as well. So that's one of the advantages of making sure you have tests around so that as soon as you test positive, you can get treatment. And so I can pause there and turn it over to Dr. Yu.
Thank you.
Do you want questions first or you want to?
We'll take the questions at the end. Yeah. And then
用
any
中文都講一次。
你用中文講一次 OK 好得。
用中文講一次。
好。咁剛才咧，黃順醫生咧就講翻我哋今年咧，亦都係呼籲我哋所有市民咧就係有機會接種新嘅新冠病毒疫苗，因為咧最近咧亦都有變種嘅新冠病毒啦。咁同時間咧，我哋亦都呼籲市民咧有機會亦都係去接種呢個流行性感冒嗰個病毒嘅疫苗啦。最後咧就係呢個叫 RSV 就人類呼吸道合胞病毒嗰個疫苗嘅。咁剛才講到咧，就係首先喺呢個新冠病毒，我哋以前都講過好多次咧，呢個接種疫苗咧係可以減輕同埋咧避免呢個如果感染到呢個新冠病毒佢嗰個副作用啊同埋個傳染性咧，係咪？咁就係唔係話你唔會感染到新冠病毒，但係得病之後咧就係將嗰個病徵咧減到最低嘅。亦都剛才咧醫生講到咧，喺呢個新冠病毒咧，亦都如果係有機會檢測，聯邦政府咧而家再次係提供免費嘅 testing kit， 即係嗰個檢測檢測呢個新冠病毒啦。咁如果你檢測到係的確診係新冠病毒嘅話咧，咁亦都可以同你嘅醫生聯繫去接受藥物嘅治療啦。咁呢個包括係 Paxlovid 啦。咁 Paxlovid 就係如果你服用嘅話咧，就越早服用確診咧，就可以盡快咧就控制同埋減低佢嗰個病情嘅惡化嘅。咁就係可以防止你好多特別有慢性病或者老年人士咧係嚴重嘅病情啦，或者甚至乎避免佢需要長期住院嘅。咁關乎到呢個數據咧，就係話喺6個月或以上咧，我哋都呼籲啲市民咧就係可以去接種呢個新冠病毒嘅疫苗啦。咁呢個疫苗咧好多時而家喺你嘅家庭醫生啊，或者喺診所啊，我哋啲衛生局啊，或者譬如喺Walgreens 啊、CVS 啊呢啲位置咧，都可以咧約時間咧同當地咧就係接種呢個疫苗嘅。咁特別咧呢個65歲或以上，我哋老年長者人士咧，亦都係應該咧即係特別要考慮呢個 COVID-19 vaccine 呢個新冠病毒嘅疫苗嘅。咁關乎到呢個檢測嗰個咧，就係國家咧而家聯邦政府係每戶咧可以派發4個免費嘅新冠病毒檢測嗰個 kit 嘅嚇。咁關乎到呢個孕婦咧， 就頭先黃醫生講到咧，我哋都呼籲呢個孕婦咧每年都應該去接種剛才呢3種嘅疫苗咧，特別係流感同埋 RSV 嘅。咁 RSV 咧就可以只需要暫時接種1次就 OK。咁關乎到喺孕婦嗰度咧，就佢可以亦都減低佢嗰個風險啦，係咪？同埋喺 RSV 嗰度咧，嗰個叫做疫苗咧，我哋呼籲喺啲孕婦喺大概32至36週嗰陣時咧，就可以去接種呢個疫苗嘅。咁呢個 RSV 咧，佢有好多情況咧，佢會如果你感染到，特別喺64或者60至74歲嗰個數量咧，歲數咧，可能會對心啊、肺啊、肝啊、同埋kidney 啊、liver 嗰啲咧，同埋有糖尿病，同埋或者有肥胖症嘅咧，或者佢哋嗰個免疫系統係減弱嘅咧，都會有影響嘅。所以呼籲咧啲人咧係去考慮接種呢個 RSV 嘅疫苗嘅嚇。咁呢個就係剛才關於嗰3樣疫苗嘅總結。Thank you. Did I miss anything, Dr. Yu?
No,
Okay.
You translate a lot more than Dr. Han said.
I just went through the top points and from the old times too.
I was gonna say, I don't think he said all that. Good morning. Dr. Han earlier mentioned about who and why you should get the COVID, influenza, and RSV vaccine. I'm going to talk about how you can access the vaccines. Now, Dr. Han said that the federal government has allowed this year in terms of free COVID testing. However, in terms of vaccination, the federal government has ended the free vaccines for COVID this year. Do not worry, because if you have insurance, you definitely should go to either your primary care doctor or any pharmacy like Walgreens to get your vaccines. It is probably best for you to go to your primary care doctor to get the vaccine so that there's some continuity of records as you continue to get care. If you do not have insurance, again, don't worry. In California and certainly in San Francisco, this year, in fact, California expanded Medi-Cal access to anyone that meets the income eligibility status, regardless of your immigration status. This is particularly important in our community, so you do not need to worry. If you qualify for Medi-Cal, you can definitely get enrolled into Medi-Cal, which is a much better way for you to first get enrolled and then get a vaccine from your assigned medical care group, because your insurance coverage will allow you to get long-term medical care from any assigned medical group that you end up choosing to. If you do not qualify for Medi-Cal in San Francisco, you certainly qualify for Healthy San Francisco. It is not a health insurance plan, but it is a health access coverage. As long as you are a resident in San Francisco, regardless again of your immigration status, you will qualify. The SFGov site /vac site gives you enrollment in how to enroll into both Medi-Cal or Healthy San Francisco, or other insurance that you might qualify for, like Healthy Worker, if you take care of seniors or elderly. So there are a number of potential insurance coverage options that might be available to you. If you're not certain, certainly, hit the sf.gov, I don't know if that's forward or backwards /vax site to get the phone number as well as the contact point for how you get enrolled. So it is very important this year for you to get the vaccines. You do not need to worry about your income status, your immigration status. You can get the vaccines from a number of different locations based on your coverage situation.
剛才咧，余醫生講到咧，就係、如果你呢個保險問題，或者去邊度接種，或者你有啲咩驗疏，咁咧首先咧我哋聯邦政府嗰個免費疫苗嗰個計劃咧關乎新冠病毒個免費疫苗計劃就已經停辦咗啦。咁但係咧，我哋唔需要擔心嘅，因為咧我哋而家政府咧亦都有其他嘅方面咧去提供呢個服務啦。咁第一就係、如果你係暫時冇驗疏咧，你可以同加州 Medi-Cal， 即係我哋中文俗稱白卡嗰度咧，就同州政府申請 Medi-Cal 咧，可以去申請呢個保健驗疏啦。咁咧就另外咧就係、我哋如果你係唔符合或者係無證移民咧，預期逗留嗰啲都唔需要擔心嘅， 因為咧我哋州政府咧亦都有計劃，而家咧就係有一個計劃保護同埋提供埋服務俾無證移民。咁如果無證移民或者其他人都係唔符合呢個 Medical 即係白卡嗰個計劃咧，亦都可以同我哋三藩市 Healthy San Francisco、Healthy SF 嗰個計劃，就係健康三藩市，係一個唔係全面嘅醫療保險，但係都係提供我哋呢個部分嘅醫療服務嘅，俾有需要人士。咁咧我哋可以喺網址 sf.gov/VAX 係 sf.gov/VAX 嗰個網址咧，可以咧得到資訊點樣去申請呢個 Medical 啦，或者係 Healthy San Francisco 嘅。咁我哋一旦你申請咗之後，有咗嗰個保險啦，健康險疏啦，咁就可以到我哋三藩市唔同嘅分局、衞生分局接種疫苗啦，或者係同你哋自己啲驗疏，因為有啲人可能有自己嘅藍卡啊、紅藍卡啊、白卡啊，同埋如果係 IHSS 工作者咧，有佢哋嗰個工作嗰個保險，亦都係提供俾市民嘅。Thank you. At this moment, we can open it up for any questions. 咁如果有任何問題咧，我哋可以咧俾大家問一問我哋兩位醫生嘅。
Is it that 3 kinds vaccine can at the same day get together at the same day?
Yes, it is safe to receive the vaccines together at the same time, and many people choose to do so for convenience. And of course, it's also okay to receive them separately. I do want to talk a little bit about the timing of getting the vaccines because a lot of people have questions about that. October is a great month to receive your vaccines, and the reason for that is because it's before the start of the winter respiratory virus season. We can never predict exactly when the levels of the viruses will increase in our community. That's really hard to predict. Some years it comes as early as November, some years it's December, January, February. So because we want to make sure that everyone is protected before the start, that's why we recommend in general September, October is a good time to get the vaccine. Of course, if you happen to miss October, then go ahead and get it in November and December, but definitely try to get it this fall in the next month or two.
As I know this year, the effectiveness of the flu vaccine is a little bit lower than before. Can you say a little bit more about that?
Yeah, so the question is about flu vaccine effectiveness. And so effectiveness, as you know, can vary from year to year. It's hard to predict at the start of each year what is going to happen in the coming year. And so, unfortunately, I won't be able to comment on that. But what I can say is that no matter what the effectiveness is, we know it will provide some amount of protection. We know that no vaccine is 100% protective against everything, and that's why we also talk about taking personal hygiene measures such as staying home when you're sick, or washing your hands, or using a mask when you're in a crowded indoor space. So together, all these things, in addition to the vaccines, can help reduce the chances of getting sick or getting severely ill with some of these respiratory viruses.
Let me first translate first. 剛才咧有兩條問題咧，第一咧就係問到我哋3種嘅疫苗咯，可唔可以同時間接種嘅？咁剛才黃醫生咧就話係冇問題啦，可以同時間接種我哋嗰個 COVID 啦、flu 同埋 RSV vaccine 嘅。咁幾時接種係最好咧？就係依家10月份咧，其實係一個非常之好嘅時間，因為喺我哋通常見到冬季寒冷天氣變寒嗰陣時咧。就呢啲病毒傳染咧比較犀利啲嘅，咁所以咧喺11月、12月或者1月咧呢個流行性感冒或者 RSV 甚至乎 COVID 咧都可能會來臨嘅，咁所以咧9、10月係最好嘅時候啦。咁但係如果喺10月份都接種唔到嘅話，咁盡快呼籲啲市民喺11月或者12月啊幾時咧盡快去接種嘅。關乎到剛才嗰啲流行性疫苗佢個effectiveness 即係有幾有用啦，係咪？即係 抗衡呢啲病毒咧？就係因為每年你都知道係睇下我哋預計有乜嘢嘅病毒，邊種嘅 virus， 咁就好難講到話今年有幾 effective，OK？ 但係咧就我哋都係呼籲咧，盡快咧你係去接種啦。咁遲啲咧我哋會有數據可以提供俾大家嘅。Thank you。
係咪而家暫時未有相關數據？即係可能譬如重症率接種率呢啲咁。
So the question was from Skyline TV regarding the numbers of, let's say, how severely ill one gets or the hospitalization rates, right? I think, are you talking about COVID or RSV or flu?
Any data can share with us?
Yeah, okay.
So the question is basically how bad is, how severe is the
current
disease?
season, yeah.
Yeah. That's a hard one to answer. Yeah, I think so. Regarding flu, I think it's difficult to answer before the season how severe it will be. I think when the season starts getting going, we start getting early signs of if it's going to be a bad season or not. Some of the factors that go into that is it depends on which strain of the virus, of the flu virus, is predominant. Usually when there's an H3 strain of the flu that's predominating, that indicates that it tends to be more severe. You might expect more hospitalizations, more elderly people getting really ill. When it's an H1 season, that's another strain, then it tends to be a little bit less severe. And there's some early indications that this may be an H3 season, which would indicate a little bit more severity. But unfortunately, it's quite early. Since we're only in October, we really won't have a better sense of that until later in the fall or even into the winter. And then when it comes to COVID, of course, that is also pretty unpredictable. We know that generally what has been happening is there have been two sort of waves of COVID every year. We just finished a wave over this past summer and early fall. We would expect another one to come out sometime this winter. The severity, I don't think anyone expects that the severity will be much greater or less than in the last year or two. But we'll see what happens.
Thank you.
做個簡單嘅翻譯先。咁剛才問題咧就問到我哋嘅呢三種嘅病毒，譬如 RSV、流感同埋新冠病毒咧，佢有幾嚴重咧，或者病情有幾惡化咧？咁剛才黃醫生講到咧，喺流行性感冒咧，有兩種嘅病毒，如果有一種係叫 H3 即係 H3嗰個 strain 咧，嗰種嘅病毒咧，喺歷嚟咧，我哋見到數據咧係一般比較嚴重啲嘅啲情況。咁如果係 H1 即係 H1 嗰個情況咧，嗰個嚴重性咧就係比較減低啲嘅。因為而家嘅時間係喺10月份咧，咁我哋未有辦法可以吸取到今個嚟緊嘅季度嘅數據。睇緊以前嘅就係知道，即係剛才所講到 H3 同 H1 嗰個分別嘅。咁關乎到新冠病毒 COVID-19 咧，我哋就知道有兩個波浪㗎嚇。第一波咧就通常喺呢個夏季 summer time 嗰陣時，所以今年見到喺 June 啊、July 啊、6、7月份嗰陣時咧，嗰個傳播率一直到我哋秋季嗰陣時咧就比較犀利啦嚇。咁跟住咧就係冬季 winter time 嗰陣時咧，就知道會有第二波咧比較傳播，因為我哋歷嚟咧呢幾年咧見到都係咁樣傳染嘅。咁但係咧而家我哋知道咧即係佢有變種同埋有接種疫苗咧，佢都係唔會到翻我哋最初期喺第一年嗰陣時咁嚴重嘅情況嘅嚇，都係同一個普通嗰個流行性感冒有啲類似嘅。Thank you.
And I have one more question. Is it the three vaccine is the same form, like only one format? As I know, the flu they has like through the nose, don't need to take the shot. Is it another one has the same format?
So yeah, right now the flu vaccine is the only one that is available as the spray, into the nose. And then, I know that they're working on others for other, for example, for COVID. I also know that they are working on like combined COVID flu vaccines, but unfortunately those are not available yet. And so right now, they still are separate vaccines.
剛才亦都問到咧，就係點樣接種呢啲疫苗，呢3種嘅疫苗嘅，有冇一支針過，或者係有啲我哋知道係經過鼻孔嗰度噴劑嘅。咁暫時嚟講咧，喺呢個流行感冒嗰個疫苗咧，就可以經過鼻窿鼻孔嗰度咧就噴入去嘅。咁其他咧仲係要打針。咁亦都有人問過咧，譬如呢個 COVID 同埋流行感冒有冇綜合針咧、混合針咧，就暫且係未有，仲喺研究緊嘅。咁所以係要分開去接種嘅。唔該。
And seems like because I just got the due last week, it seems like the doctor doesn't promote the RSV to us. Is it the doctor is not getting the information, or you need to require yourself?
Yeah, I think that's a very good question about RSV. So I think there's an important difference between flu and COVID vaccine and RSV vaccine. Flu and COVID vaccine are essentially universal vaccines. Everyone should be getting those if you're over 6 months of age. RSV vaccine is different because only some people should get RSV vaccine. For example, older people should be getting RSV vaccine, and pregnant people who are between 32 and 36 weeks. So RSV vaccine is not something you're going to see everywhere. It's going to be something where you should be talking to your doctor if you're in one of those particular groups.
I heard the RSV vaccine also available for the young kid. Is it right?
There is, it's not exactly a vaccine in the same way, but you're right that there is an injectable antibody that is available for babies who are born during the RSV season. And that's something that the pediatrician will know about and be able to offer. And so that's different from the RSV vaccine that we're talking about for older people and for pregnant people.
Thank you.
剛才嘅問題非常之好啦，我哋要澄清一下呢個RSV 嗰個 vaccine 嘅，係咪？頭先你第一條問題係咩話？
啲醫生唔會主動嗌你。
係。OK，so 嗰個 RSV vaccine 咧就同流感同埋新冠病毒嘅唔一樣嘅，因為頭嗰兩種咧就係全面性嘅，所有市民咧都係呼籲佢應該去接種。咁但係 RSV 咧就係主要係針對長者同埋孕婦嘅就唔適用於所有人去接種嘅。咁剛才都問到咧，係咪有啲啱適合呢個嬰兒或者細路哥嘅咧？咁就係如果一啲嬰兒喺呢個 RSV 季節出世嘅話，咁我哋有啲叫做 RSV 嘅抗體 antibody 可以接種俾嗰啲嬰兒，但係佢同一個正式嘅 vaccine 咧，即係嗰個疫苗咧，係同成人疫苗唔一樣嘅。Thank you.
Thank you. That's all.
Any other questions?
Thank you. 你有冇特別想補充
Anything else we would like to add?
No, yeah. Covered it.
How about KTSF? I know we want to give you an opportunity to follow up, and I can give you all the names later too.
Oh yeah, that would be great.
Yeah.
So do you mind doing a one-on-one interview?
Sure. I think the doctors may have a few minutes.
Okay.
Maybe they can, you can